Hi, beautiful people. How are ya? I hope you're having a great day. I hope you'll watch this video to the end. I'm sharing my heart with you, just a little message and what's happening with me in the last few days, actually. I'm very thankful you're here and you've chosen this channel to be a part of. I feel blessed for your participation. We don't celebrate our suffering. We celebrate in spite of our suffering. And together we support one another and love one another. Today, I want to talk about intraepithelial lymphocytosis, non-celiac gluten sensitivity, and how all of this might relate to fibromyalgia. Here we go. Our immune system fights infection-causing pathogens like viruses, bacteria, and fungi, and parasites. In addition, harmful cells, such as those that cause cancer, are fought by our immune system. T cells, also known as T lymphocytes, are a type of white blood cell. They play an important role in our immune system. T cells protect us by destroying harmful pathogens and by sending signals that help control our immune system response to threats. Most of the T cells, lymphocytes, in our GI tract are T cells. Intraepithelial lymphocytosis, or as I'll call it IEL, is when doctors can see an increased number of lymphocytes in the tissue sample of our GI tract. It can be a sign of GI conditions such as Crohn's disease or celiac disease. Do any of you have those? Another name for this is duodenal lymphocytosis, depending on where in your GI tract these lymphocytes were detected. If increased lymphocytes are detected in the stomach, it's called gastric IEL. If it's in the middle of the small intestine, it's called jejunal IEL. If it's at the end of the small intestine, it's called ileal IEL. And if in the large intestine, it's called colonic IEL. The purpose of IEL in the GI tract is to produce molecules that reduce inflammation, activate killer cells that destroy infected or damaged cells, and produce molecules that increase inflammation. So IEL cells are important, but excessive lymphocyte activity in the GI tract is responsible for the gut damage seen in people with celiac disease and other GI disorders. IEL is our body's response to injury in our GI tract. There are conditions that stimulate IEL, such as celiac disease, topical sprue, inflammatory bowel disease, such as ulcerative colitis and Crohn's disease, small intestinal bacterial overgrowth, allergy to dairy or soy, autoimmune enteropathy, graft versus host disease, drug-induced colitis, and GI ulcers. So, to determine if there is an excess number of IELs in the small intestine or elsewhere, a duodenal or whatever type of biopsy is necessary. If the result states the normal limit of IELs are between 5 to 10 per 100 epithelial cells, then they consider it normal. So it's normal to have a small number. But if the number is 20 to 25 per 100, that's considered pathological. The near normal cases, 5 to 20 per 100, is where it gets a little tricky, and you hope that the lab personnel and pathologist, as well as the surgeon who does the biopsy, are skilled. Testing for IgA deficiency is necessary, while IgG testing, isotope of TTG, is mandatory. There's also the possibility of a false positive in patients with inflammatory bowel disease or cardiovascular disease or autoimmune enteropathy and other diseases. In addition, a routine collection of esophageal and gastric biopsy specimens should be performed to clarify if gastritis or eosinophilic esophagitis are present. IEL can be a sign of an underlying gut disorder, but it isn't a disorder itself. So our doctor needs to biopsy sections of the gut and send off for examination to determine if there is a disorder. Some examples of the symptoms of increased IEL are from the following disorders: Crohn's disease, celiac disease, so symptoms can certainly vary among different diseases. Let's briefly discuss the occurrence of duodenal intraepithelial lymphocytosis in patients with fibromyalgia. Fibromyalgia is recognized as pain, sleep disturbance, and fatigue, but other medical symptoms include memory, thinking problems, and psychological distress, among so many other medical problems. About 70% of people with fibro have symptoms of IBS, and 60% of people with IBS have fibro. Those are significant numbers, and I feel this is important for us to discuss. Do any of you ever feel like the stomach pain, bloating, and IBS-C and D symptoms are something more? I do, or at least I have. But so far, nothing has turned up. That's a good thing. The problem is the absence of diagnostic features, such as antibodies of known disorders. So now what? How do you get a doctor to listen? How do you get a doctor to perform tests that you want done, such as testing for duodenal intraepithelial lymphocytosis? We start by asking them. So if you're having a scheduled endoscopy, that would be a good time. I recently had a colonoscopy performed, but not an endoscopy, which would have been a good time for this to be done, but I didn't ask. At the time, I just felt grateful that my doctor perhaps didn't think it was necessary, but we really didn't discuss the various different esophageal issues I'm still having. So we'll see how that goes in the future. Non-celiac gluten sensitivity is increasingly recognized as a frequent clinical condition with symptoms that appear like celiac disease in the absence of diagnostic features. IEL without villus atrophy, located in the small intestine, and without specific celiac antibodies has been shown to be part of the spectrum of non-celiac gluten sensitivity. Together, non-celiac gluten sensitivity, duodenal intraepithelial lymphocytosis, and a clinical response to a gluten-free diet raises the hypothesis that non-celiac gluten sensitivity could be a treatable cause of fibro, according to a 2014 study, but only for a small number of patients. And that's definitely something to remember. In a 2020 study, researchers determined that there is a scarcity of quality research in the area of gut microbiota. which isn't exactly what we're talking about today in this video, but I felt that this was important. As we have reported from previous studies, the gut microbiota may play a role in fibromyalgia within the emerging field of the gut musculoskeletal axis. It's important for researchers to continue examining this important topic. But a newer study from 2023 found the prevalence of non-celiac gluten sensitivity in 142 fibro patients was similar to the general population. So we're no different than anyone else, whether we'll be non-celiac gluten sensitive, which is at about 5.6%. I think the general population is 1 to 3%. Symptoms of gluten sensitivity include gas, bloating, abdominal cramps, diarrhea, fatigue, and balance problems. Good grief, I think I have all of that. About 22% of those with non-celiac gluten sensitivity showed an improvement in intestinal symptoms on a gluten-free diet. So just know that when going into changing your diet, you should work with a health professional. But here's another health statistic. People with both IBS and fibro are 7 times as likely to have undiagnosed celiac disease. Well, I've had a colonoscopy many times, and they don't seem to find anything weird going on in my small intestine. So I don't think that's my situation. Is it yours? However, let's get back to gluten sensitivity. In another 2023 study, researchers determined that fibro patients who went on a gluten-free diet reduced their widespread pain and symptom severity. Wow. 20 postmenopausal women, so a small study at this time, who had fibromyalgia, but no history of celiac disease participated. A gluten-free diet was assigned for 6 months. Then that was followed by 3 months of a non-restricted gluten-containing diet, so they could eat whatever they wanted. Then followed by a new gluten-free diet for another 6 months. At each visit, the widespread pain index and symptom severity scale score were evaluated. What's interesting is that none of the fibro patients had a history or diagnosis of IBS, although they reported vague gastrointestinal symptoms. And here are the results. If there is the presence of diarrhea and intraepithelial lymphocytosis, then a gluten-free diet should be considered. Digestive symptoms usually improve in that type of cohort. In patients without intraepithelial lymphocytosis, a gluten-free diet may not improve symptoms in all patients, but those large numbers that I just revealed to you are very enticing. These findings offer hope and potential dietary strategy for people with fibro who seek relief from their symptoms. But anyone considering dietary interventions for managing fibro should consult with a healthcare provider or dietitian to create a personalized plan, right, that suits your needs. More studies are needed to understand this relationship between diet and fibro to confirm these findings. A larger and more diverse population, including people with celiac disease and fibro. So could you give up gluten? I think I would if I discovered I had intraepithelial lymphocytosis, because giving up gluten would be really, really hard. I mean, if you're sensitive to gluten, you have a choice, and there's power in that choice. Like, you could still have that slice of pumpkin pie at Thanksgiving, knowing that there'll be a price to pay, that your body, your small intestine, isn't getting injured or those villi being injured. But is it worth the price of being in pain after eating that wonderful slice of pumpkin pie? Thank you for staying to the end. I spent 3 days editing that last video called Joyful Living with Fibromyalgia and Chronic Pain. God is good. Being joyful is a choice, right? I have chosen to be joyful. Am I always perfect at it? No, no way. I know that it wasn't a research topic, but it does show that I haven't given up. I'm nobody, but you're here. Thank you. My heart is to show you that our lives are intertwined with one another. You have projects that you like to do, right? And family events that are important to you too. Maybe you feel too poorly to attend them, and I'm sure they love you anyways. So I hope you'll share those. Without comments, this channel doesn't get noticed by YouTube. Plus, it's a way for us to interact. I'd love responding to your comments, and I'd love to hear what's important to you. So if you haven't yet watched that particular video, I know it was long, I think 35 minutes, but I really enjoyed sharing it with you. And if you notice carefully, I will sit still very much so in the boat because I don't have good balance, and my husband appreciates it, that I don't try to move around. He doesn't want to have to rescue me from the water. I've linked that video below. The yard work, which is not done, but it did take me a couple of months to get to that place. On Saturday, I worked on fixing the plastic that got thrown about because of that bad hailstorm that we got. And then on Sunday, I got the rest of it covered with plastic, moved some rocks around, fell. Don't know if you can see my algae. I went head first down. That's the second time I've fallen. The first time I fell right on my head. Oh, good grief. But on the soft ground, it was okay. I checked all my body parts to make sure I was good. Yep. Week later, then I do this on my arm. And I was moving a big rock, one this big around. I'm shoving it because I wanted it in a different place. Lost my balance. And that's what happened. I just went right down. Crazy. Then I had my husband dig out a big bushy weed that was in one of my bushes. So it's finally ready for stone to be put on it. Why is this important for me to share with you? It gives us a chance to encourage one another to get things done. That's important to me. I wonder what life is going to be like when I lose my central vision. Honestly, I can't even think about it. I can only focus on where I'm at now. So if you've noticed, I stopped putting my eyeliner on. It's not that important. I did attempt to do my eyebrows. I think I got it all in the right place. We'll see. Maybe sometimes we need to push ourselves to get things done. I still have that back room in there to get decluttered and organized. I've been thinking a lot about what I want to do in those 2 bedrooms, and I think I have it. And then behind me here, I think what I'm going to do is put starting, it's hard to see. Oh, it's my chair. So starting from right here over, I think I'm going to put 3 tall black shelving units up and pretty that up back there. Here's the thing. I have a lot of things in my head I want to get done, and there's only so much time and only so much I can do. I mean, I still hurt all over. Not as much as I did once upon a time, thankfully. But I still hurt enough that I got badly sunburned outside and didn't even realize it. I don't feel the sunburn. My husband, I took some lotion to him and said, "Can you put this on my back? I just want to make sure that it's dry and itchy and something." He said, "Wow, you're really sunburned." I said, "I am, because, my skin hurts." So I just really didn't notice. I just keep pushing forward to get things done. Do you do the same thing? And since I didn't wear good shoes while I was out there working in the yard, I further horribly inflamed my plantar fasciitis. I mean, I wasn't going to wear my new tennis shoes out there to get them all dirty, but I paid for that. And at the podiatrist yesterday, she gave me an injection in my left heel because especially both of them hurt, but especially that left heel was just horrific. Jeez. So I got an injection. Oh my word, that hurt. But the good news is that almost immediately I had the feeling of warmth and a complete lack of pain in my heel. It was wonderful. But she informed me that in the evening, I would probably want to put some ice on it. Well, I didn't really need to yesterday, but this morning I definitely did. So I've been icing my foot as I'm sitting here. That's helped tremendously. And I think I could wear my shoes and not be in a lot of pain. And then yesterday afternoon, I went to the dentist and got my finished crown right there. So pretty. It looks just like a normal tooth. Doesn't hurt or anything. It's a little weird having a tooth in there. This afternoon, I go to the eye doctor to get my eye injections. I'm not looking forward to it, but I am looking forward to slowing down the geographic atrophy. My husband doesn't want me driving right now. So he's taking me to all of my doctor appointments. My daughter is back to work, but it was nice for a while, for a few months, for my husband not to have to take time off to get me to all of my doctor appointments. I do know my eyes have gotten worse. But I think on a nice, bright, sunny day in town, I'll be fine driving, just maybe to Walmart. But I'll see what the doctor says when I go there this afternoon. But guess what? I need you all. We need each other. I send you gentle hugs and support. Love you.